chiropractor, Dr. Gregory Johnson. We have Sandra here with us this morning, and Sandra has watched our YouTube videos, including the ring dinger, and she's feeling awfully compressed in her lumbar spine area. I've already done a complete orthopedic neurological evaluation on her and palpated her and evaluated her posture, but we're going to do her posture again for you. So let's relax your arms and flex your head forward and backwards now, and then neutral. She's a little bit forward and a little bit translated to the right of center on her cervical spine. That puts additional weight-bearing compressive stress in the muscles and ligaments and disc all the way down into the lumbosacral spine region, which is where she's feeling the compression. Also did a cervical distraction test on her, which was positive. It relieved her pain when I elevated her head. So she's going to get her first adjustment today. Okay, let's go ahead and have you lay down here on your tummy. There we go. Right leg is a little bit longer than the left leg in this position. Now when I bring it up, actually, her left leg gets longer, and that tightens up in your lower back, doesn't it, Sandra? Yes. So she's got sacral iliac subluxations bilaterally, and she's most sore on this left one here, but she's also got retrolisthesis on L5, L4, L3. These are all a little tender, aren't they? Mm-hmm. So I'm going to start adjusting her pelvis first, her SI joints. That was the left one, now I'm on the right one. And then the sacrum, straight superior to inferior, SI. This adjusts the sacrum away from L5 and helps take that pinching off the nerves. Now I'm adjusting her L5 vertebra, straight P to A, which is posterior to anterior. L4, these are a little sore at first when I do them. And the patients definitely feel that. There you go. That girl. Good job. Yes, ma'am. Now, you've been adjusted before?
17 years ago.
17 years ago. Not like this, I bet.
No.
There we go. Excellent. Now, let's turn you on your back, please.
I felt that pop.
All the way in your upper back. Yep. Okay. So, I'm just going to adjust your neck first. I'm going to put your hips up and back over your shoulders where it's supposed to be. Good. There. Now, let's slide you down this way a little bit. And let's put your arms out to the sides. Been a lot of talk lately on YouTube, other chiropractors doing versions of my ring dinger. They're calling it different things, which is okay. I guess people copying you is the highest form of flattery you can get, huh? Yeah. Take a deep breath in for a second. I'm just going to pull your tummy down and line these ribs up a little bit. Yeah, that's a little tight too, isn't it? Sore? Yeah. Yep. Okay, now you can relax your hands on your tummy. And just let me have your leg here. There, now you should have felt that in your knee all the way up to your low back.
Yeah.
Good. Okay, just keep breathing and relaxing. Yes, ma'am. Good job. Okay, let's just get face towards Joseph there. Okay. Oh yeah. Snap, crackle, pop. Oh, what a relief it is. Sound like a bowl of Rice Krispies. I'm just pouring on the milk. Good. In fact, that's what I think I'm going to name this video. Snap, crackle, pop. Oh, what a relief it is.
Yeah, it is a relief.
Well, you'll be even better once I do the decompression on you.
I've been waiting.
You haven't had your first ring dinger yet, yeah. There we go. Good. Okay, let's come over here. Alrighty. So we're gonna lay on your back with your pelvis right there and head up that way. Down this way just a little bit, please, Sandra. A little bit more. There we go. So I'm pinning your pelvis in now. Slide down just a tiny little bit more. There you go. Yep, perfect. You in there tight, aren't you? Yeah, I don't want you to get away. No. This is what makes this ring dinger unique, is that I am completely fixating the iliac crest into below these pins so it stabilizes the pelvis, and that way when I do the straight vertical horizontal in this position, but y-axis traction, it locks that pelvis down so I'm getting movement from the occiput all the way down to the sacrum. Just breathe normal. There you go. And that's why we call it ring dinger. Breathe. Keep breathing. There you go. Breathe in through your mouth, out through your nose. She's still kicking, folks. That's good. There you go.
Okay.
Good girl. You're fine.
That's hilarious.
Yeah. Okay, now we're going to do the Palmer diversified cervical. There you go. Oh yeah. What a relief. Now the first ring dinger is pretty dramatic.
Yeah.
You felt everything
I
move,
did.
didn't you?
All the way down.
All the way down, yep. Alright, I'm going to have you come over here and stand in front of the mirror again. Okay, now we're going to close your eyes again, Sandra, and flex your head forward and backwards, please. And then back to normal. Take a look in the mirror now. Look how much more square you are. See how your arms and shoulders squared off? Your hands are at your sides now.
Mm-hmm.
You're going to feel a little, this is your homework, by the way. You're going to lift your shoulders straight up, pull them back. There, she's been watching, all right? We're going to look back at the wall behind you. It's a lot of extension. I'm adjusting the atlas with this instrument on the x-axis. This sends a barrage of neurological information called proprioception into the cerebellum. Cerebellum controls balance, posture, coordination, and all kinesthetic movement. Now when you flex your head forward and backwards, it should feel a little smoother than the previous ones.
Yeah.
Take a look. You're right down the middle everywhere.
Yeah.
Very good. So what would you tell people about your very first adjustment here at Advanced Chiropractic Relief?
It feels good. I feel better. And it's,
Was it everything you expected from watching our videos?
Yes, but it was a shock.
Mm-hmm.
Yeah.
That's shock and awe right
Yes.
there. That's why we call it ring dinger.
Yeah.
Thank you for sharing your story with everyone. This is your Houston chiropractor, Dr. Gregory Johnston, coming to you from Advanced Chiropractic Relief in Houston, Texas, home of Super Bowl 51 with the Patriots and the Falcons. I'm actually rooting for the Patriots, but we welcome all the Atlanta fans to come here as well. So we'll see y'all soon.